Do you feel tingling, numbness, or burning in your hands and arms, and you've been told it's peripheral neuropathy? The tricky part is the exact same symptoms can also come from a pinched nerve in your neck called cervical radiculopathy. Knowing which one you really have can be the difference between a speedy recovery or ongoing chronic pain and frustration. In this video, I'll show you the similarities, the key differences, and how we apply the Asuta Method to treat both conditions so you can finally get lasting relief. And I'll also share the one treatment that can make all the difference if your problem is cervical radiculopathy. So keep watching. Hi, I'm Dr. Ole Olson, America's neuropathy coach and founder of Asuta Health Neuropathy Centers. This is one of the only channels on YouTube entirely dedicated to helping people with peripheral neuropathy finally get lasting relief. Subscribe now if you're looking for natural relief, proven daily routines, and real-world solutions that actually work. You're in the right place. At Asuta Health, we help you move better, feel better, and live with less pain every single day, because you matter. When patients come in with tingling, numbness, burning, or weakness in their hands and arms, the first thing I explain is that these are all signs of nerve irritation. The challenge is that nerve irritation can come from two very different sources. It could be a peripheral neuropathy, where the nerves themselves are damaged, or it could be cervical radiculopathy, where a nerve root in the neck is being pinched. Because both conditions affect the same nerves in the arms and hands, the symptoms can look almost identical. This overlap is why so many people are misdiagnosed. They chase treatments that never solve the problem and end up feeling frustrated and stuck. That is why clarity is so important. If you know which condition you actually have, you can choose the right treatment and often speed up your recovery. So let's begin by looking at how peripheral neuropathy shows up in the hands and arms and the patterns that you need to be watching for. Peripheral neuropathy usually shows up in a very distinct way. It often affects both hands at the same time, and the symptoms usually start in the fingers and move upward almost like wearing a glove. People describe tingling, burning, or numbness that can get worse at night, and in some cases even weakness when trying to grip or hold objects. The most common causes include diabetes, vitamin deficiencies, certain medications, alcohol, and even chemotherapy. What makes neuropathy different is that it is usually symmetrical and not tied to neck movements. If both hands are involved and the pattern spreads evenly, that is a strong clue that it may be neuropathy rather than a pinched nerve. I have many videos on my channel that go deeper into peripheral neuropathy, where I show you specific home exercises, diet strategies, and natural treatment options that you can use without relying on medications. Be sure to check those out if you're experiencing these types of symptoms. Now this is where things get interesting, because cervical radiculopathy looks very different. Let's take a closer look at how a pinched nerve in the neck creates symptoms in the hands and arms. Cervical radiculopathy is very different from neuropathy because it usually affects just one arm at a time and not both. The symptoms follow a nerve root pattern, which means the exact fingers or part of the hand that are numb or tingling depend on which nerve in the neck is being pinched. For example, if the C6 nerve is irritated, the numbness often shows up in the thumb and index finger. If it's a C7 nerve, the middle finger is usually affected. And if it's a C8 nerve, the tingling or numbness is more common in the ring and pinky fingers. Another big clue is that symptoms often change with neck movement. Turning or extending the neck can increase the tingling or pain. And many people also feel stiffness or aching in the neck or shoulder on the same side. This pattern is a key way to separate radiculopathy from neuropathy, and it is one of the most important things to pay attention to when symptoms start in the hands and arms. Now that you've seen how each condition presents itself, let's compare them side by side so you can clearly spot the differences. Neuropathy usually shows up in both hands, with a glove-like pattern that spreads evenly. It is often tied to systemic issues like blood sugar, vitamin deficiencies, or even certain medications. Radiculopathy usually affects just one arm at a time and follows a very specific nerve root map. The symptoms can change when you move your neck, and they often come with stiffness, aching, or even sharp pain in the neck or shoulder. So if both hands are involved, peripheral neuropathy is more likely. If only one arm or specific fingers are affected, radiculopathy is more likely. Getting this distinction right is crucial because the treatment approaches are completely different. Now let's talk about why having the right diagnosis matters so much and what happens when it is missed. Getting the diagnosis wrong is one of the most common reasons people stay in pain far longer than they should. If neuropathy is mistaken for a pinched nerve, the patient might spend months doing spinal treatments that never solve the problem. On the other hand, if a pinched nerve in the neck is mistaken for neuropathy, someone might rely on supplements or medications that do nothing for getting to the real cause. The result? Wasted time, wasted money, and ongoing frustration, while the condition often gets worse in the background. But when you understand which one you are dealing with, you can target the problem directly and often see progress much faster. So how do we approach this in practice? This is where the Asuta Method comes in and why it has been so effective for patients with both conditions. So how do we treat these conditions differently while still addressing the root cause? In my clinics, we use something called the Asuta Method. This approach is designed to restore proper nerve function, whether the irritation is coming from damaged nerves, like in peripheral neuropathy, or from a pinched nerve root in the neck, like in cervical radiculopathy. The Asuta Method is our comprehensive approach to care. We start with a neuropathy relief roadmap to identify exactly what is going on in that individual. Next, we put together the appropriate therapies, a mixture of in-office and at-home therapies to restore proper function and empower the patient throughout the healing process. It is about creating the environment where nerves can actually recover and function the way that they are supposed to. What makes the Asuta Method powerful is that it addresses both systemic nerve damage and mechanical nerve compression when needed. This is why we have seen results in patients who have struggled with numbness or tingling in their hands and arms for years. And while the Asuta Method works for both conditions, there is one specific treatment that can make all the difference if the problem is cervical radiculopathy. Let me show you what that is. The reason cervical radiculopathy is so different from peripheral neuropathy is that the problem actually starts at the level of the spine. Our nerve root in the neck is being compressed, often by a disc herniation or disc bulge, and that mechanical pressure is what creates the numbness, tingling, or weakness that you're experiencing in the hands and arms. This is why the single most effective treatment we use for cervical radiculopathy is actually non-surgical spinal decompression. Unlike neuropathy, which requires systemic care to improve overall nerve health, radiculopathy demands that we actually relieve the pressure at the nerve root. Here's how it works. Spinal decompression gently stretches the cervical spine in a controlled and precise way. By doing this, it reduces pressure inside the disc and allows it to retract away from that nerve. This creates more space around the nerve root, decreases inflammation, and gives the body the chance to heal naturally. Many people are familiar with spinal decompression for the lower back, and it is commonly used for lumbar disc herniations. What most do not realize, though, is that decompression can also be applied safely and effectively to the cervical spine for disc herniations and cervical radiculopathy. It is a safe, gentle, and comfortable treatment. In fact, patients often tell us how much they enjoy the sessions because they feel relaxed while the machine does the work. Best of all, it delivers real results. It takes pressure off the nerve, restores function, and helps people avoid injections or surgery altogether. For many patients, this becomes the turning point where their symptoms finally begin to resolve and they get their quality of life back. Now that you understand why this treatment is so effective for cervical radiculopathy, let's finish with your next steps so you know exactly what to do if you're struggling with these symptoms. If you are dealing with numbness, tingling, or burning in your hands and arms, the first step is to get the right diagnosis. Is it peripheral neuropathy or is it cervical radiculopathy? Because once you know, you can choose the right treatment and finally start moving toward recovery. If it's neuropathy, there are lifestyle changes, nutritional approaches, and exercises that can help support nerve health. If it is cervical radiculopathy, non-surgical spinal decompression may be the breakthrough treatment that gives you the lasting relief without surgery. And if you want to see how the Asuta Method could help you heal your nerve pain, come visit one of our centers in the Midwest. We have 4 locations, and you can find the addresses in the description section below. I would also love to hear from you. Leave a comment and let me know what symptoms you're dealing with, and if you think your problem might be neuropathy or a pinched nerve in your neck, and tell me why. If you found this video helpful, please make sure you like it and share it with someone who needs to hear this. And please subscribe so you do not miss future videos. And the next video you should watch is Best Neuropathy Blood Flow Exercises. Quickly improve blood flow in legs and feet. Go ahead and watch this video next.